What's up, family? It's KG Smooth. Welcome to another segment of Aetna's Black Health 365. This is our health literacy initiative to educate you on facts, prevention, and some actionable steps that you can take to help further your health journey. And September is Sickle Cell Awareness Month. And for this segment on Black Health 365, we would like to welcome the lovely Dr. Bucknor, who is on today. How are you?
I'm doing well. How are you?
I am doing wonderful. Can you just tell us a little bit about yourself?
Sure. So, Dr. Michelle Buckner, I am a regional chief medical officer with Aetna Better Health, but also a pediatrician. And most of my career, I spent practicing pediatrics in the community.
Oh, nice, nice. Our children are. I have an affinity for children. I'm all about saving children, trees, and bees. So
Oh, all
kids.
right. I, I love that. I have a friend that's an urban beekeeper, so we may have to chat
Oh,
about that
nice.
another
Oh
time.
yeah,
Yes.
absolutely. They're so vital to, how we live and our health. And speaking of health, let's just get right into it with sickle cell disease. A lot of people have heard of it through R&B singer T-Boz from the group TLC, who suffers from sickle cell. So, can you please explain, Dr. Butner, what is sickle cell disease and how common is it?
Yeah, so sickle cell disease is actually part of a group of inherited blood disorders. Most people hear about sickle cell anemia, but there are
Mhm.
other kinds of sickle cell disease. And what happens is in this disease, the red blood cells become sickled and they become hard, and that can cause blockages in blood flow. And that leads to the symptoms that people may be familiar with. But it also other than pain, it can cause infections and other really serious complications. So it affects about 1 in 100 or about 100,000 people in the United States. And of those, more than 90% are Black or African American. And about 3 to 9% may be Hispanic or Latino. And the biggest concern, even so, it's a relatively rare disease, but many people with sickle cell actually don't receive the type of healthcare screenings and treatment. And some of that is because of the rarity of the disease. So that's why it's so important to increase awareness of the disease in the general community, but also to improve the knowledge base of healthcare providers.
Indeed. Now, when you were explaining what sickle cell disease is, and you say that the cells sickled up, what does that mean when the cells sickle?
So they take on, and many people may not know the term sickle now, but a sickle is a tool, right? And it has that
Hmm.
sickle shape to it. And so that's what happens with the red blood cells within this disorder. And so they sickle, and that can lead to a lot of, if you can imagine, red blood cells are normally kind of soft and round shaped. So when they sickle, they actually get stuck in the blood vessels. And this leads to a lot of different symptoms, one of which is anemia, which is why you have the term sickle cell anemia. And that
Mm.
means you just don't have enough red blood cells in your body to carry oxygen throughout to your organs. And that leads to a lot of the symptoms that we see. Many people that may be familiar with people that are living with sickle cell think of pain, right? So that's the
Hmm.
big one. You can imagine that if you don't get enough oxygen, you think about when you exercise and you start to have pain in your muscles. That happens with sickle cell, but more because they're just not getting enough oxygen to their blood
Mm.
cells. It could be problems within their chest or in their joints, and that leads to the pain. But that's just one of the complications.
Yeah. So with these symptoms of sickle cell disease, besides the anemia, I noticed you said the swelling of hands and feet. What other things should people look for the onset of sickle cell disease?
Yeah, so we talked about pain, and yes, swelling in hands and feet can occur too. Another, and it's more silent sometimes, is the risk of infection, but that,
Mm.
can be a deadly complication. So it can damage your spleen, and a lot of people may be familiar what happens with the spleen if you get hit in it, or if it gets damaged, it can be threatened. But the spleen actually helps fight off infection in your body, and so because of the damage that occurs with the spleen, people with sickle cell may be more prone to infections, and so it's really important that they get, the immunizations, the vaccines. We actually recommend that they take antibiotics to prevent these infections. And there's barriers sometimes with receiving the antibiotics. It's long-term antibiotics. Children can't take pills, so it's liquid and they have to be mixed up by a pharmacist. And so we're trying to figure out how to reduce those barriers. So that's one of them. It can delay their growth or puberty for kids. And so that's something that has to be watched out for. And then vision problems, even, these cells sickling in your eye has needs oxygen too. And so
Mhm.
without that, it can cause problems with vision also.
Wow. I'm interested to know, you had said that that this affects like 90% of non-Hispanic, Black, or African Americans, or the American Indian, as I'm discovering. Um, w- why are Black folks in America, their numbers way higher than our other counterparts? Is there Do you know from, research or science, is there something particular in our DNA or in our cells that make us more prone to this? And really all of the diseases, the more that I do these with Aetna, with the Black Health 365, like every time the numbers come up, Black folks in America, we have the highest of all of the ailments. And so I'm just wondering, like, is what makes us so different to be so prone to these diseases versus our counterparts? Like, what is that? Are we just that special?
Mhm. Yeah, so in the case of sickle cell, it is genetic. And there's some thought. Now, remember, I'm a general pediatrician, so I'm going to try to stay, not stretch out into the
Right, right. Just
specialty space.
stay in your lane.
There's
Yes. Well, I
some,
appreciate you
stay
sharing
in
your
my,
scholarship.
so don't, and I mean, yeah, but there's some thought that it is protective from malaria, right? And so, given our history and our journey and how we ended up in this country from our motherland, right, that this probably was protected and it protective there, but we don't need that protection here. So, with sickle cell, it is genetic. You mentioned other diseases, and a lot of the basis for what we see, disparities in diabetes and hypertension, that's not genetic based. There's been some thought, and some, uh, I guess, thought years ago, which we're learning isn't necessarily true anymore. That idea of race based medicine and we have different lung capacity and all that, those genetic things aren't there. That's more what we call social drivers of health. And so that probably is a discussion for another day. But for sickle cell, this is genetic and it just has to do with our origins and we're passing it on person to person or to our children.
Indeed. You're listening and watching the Black Health 365 extended conversation powered by Aetna. We're talking with Dr. Michelle Bucknor from Aetna Better Health. September is Sickle Cell Disease Awareness Month, and we are talking about sickle cell disease. Dr. Bucknor, what complications can sickle cell disease cause?
Yeah, so we talked, about the symptoms and the complications. For me, one of the most significant complications, along with pain and suffering and the impact it has to the family and to the community, is the decreased life expectancy. Right
Mm,
now, we're hopeful with the treatments that People with sickle cell tend to have a life expectancy 20 years younger. So if the
Mm.
general life expectancy is 78 years for people with sickle cell actually have a life expectancy of about 58 years. So, that's the ultimate consequence for me, is the decrease in life expectancy. We want quality of life, the kind of life you live is really important, and we value that and want to do everything we can to support that. But we also want it to be able to extend the life of people living with sickle cell.
Indeed. Now, I know we already talked about, how sickle cell disease is genetic. Can you
Mhm.
just, break it down as what causes the sickle cell disease, and are there known risk factors in that?
Yeah, so sickle cell being genetic is passed on from the parent to the child. And so many people may be aware that can have sickle cell anemia or sickle cell disease, or you can have sickle cell trait. So for a child to have sickle cell disease, two parents have to have the sickle cell trait. Or a person can have sickle cell disease and the other person has to have the trait or disease. And so both parents pass the gene to the child. Now, not every child that they have will have sickle cell anemia, but it's a risk for every child. And so it gets passed to the baby. So many times the parent may just have the trait. So they haven't had complications. This is
Hmm.
new to them. The idea of sickle cell, it may be in their family, so they may know people, but that's how it's passed. And so that's the risk, is whether or not you have trait. So it's really important to know your trait status. Do you actually have sickle cell trait?
So, is there difference in symptoms and complications between sickle cell anemia and sickle cell disease?
Yeah, most people with sickle cell trait will not have um, complications. So there had been information. This is why it's really important to stay up to date with sickle cell. So when I initially trained, the thought was if you have sickle cell trait, you won't have any risk. And then there were studies that came out that suggested that you could have an increased risk of sudden death as an athlete. So it was really important to know for athletics. Well, that may be disproven now according to the literature. But in general, most people with sickle cell trait don't have symptoms, but it is important, to maintain hydration status and eat a healthy diet just in general, right? So taking care of yourself, regardless of any, sickle cell risk is really important because medicine is always evolving. That's the beauty of it. It's science based and we learn more and more each day around sickle trait and sickle cell disease. But
Mm.
if you have sickle cell trait and you haven't been tested, it's you probably will never know that you actually have the trait.
Mm. Okay. And so, um, how is sickle cell disease normally diagnosed? And should
Mhm.
people like ask to take these tests when they go, to their PCP for their, annual physical, or what tests should people expect when they go to ask, or if they have it?
Yeah. So the beautiful part of this, for decades, sickle cell screening has been part of newborn screening. So in every state, it's mandated. When your baby's
Okay.
born and in the nursery, and you may know this occurs or you may not, we stick the baby's heel and gather blood drops to test for many genetic diseases, especially if there's something we should do to monitor them or treat them. And so sickle cell is one of the things that we test for. And so often, if the test is negative, a doctor may not share with you that, you had this test and everything was fine. If the test was positive for sickle cell trait, then the doctor should actually share that with you, or your provider should share that with you. Um, if you see one doctor in the hospital and then you see a pediatrician or a family medicine doc and you go on, sometimes that may not have been communicated if you're not with the same provider. And
Hmm.
so if you don't know, ask. My baby was
Right.
tested, or say you move from state to state. It's just something that's good to ask about, but it's very, very likely that that test was performed and the results are known.
Mhm. Now, so what do individuals with sickle cell disease and or sickle cell anemia, how do they manage the symptoms of sickle cell?
Yeah, so, we talked about just general lifestyle support. So, maintaining nutrition, maintaining hydration. So, that is
Hydration.
something,
Hmm.
that yeah, we should all think about every day. And rest and not stressing yourself, because with any chronic condition, lifestyle is the first layer of management.
Hmm.
And then with sickle cell, we're fortunate that we have medication. So I mentioned the antibiotics. There's a medication called hydroxyurea that's recommended. So with people with sickle cell, it's really important also to engage with primary care, but also specialty care, so that you're getting the best management of this disease that you can. And so we also recommend a simpler, it's like ultrasound or transcranial Doppler to look for stroke risk. Like that's a newer, evolving science. And that, it's painless, it's no risk, but it can detect the risk of stroke. And so it's really important because there are things we can do, like blood transfusions, to reduce the risk of stroke. And so that's why, one, being a self advocate for your family, for your child, for yourself, to say, what does current medicine suggest for my
Hmm.
treatment? And this is for everything,
Hmm.
to make sure that you're advocating to get what you need. And if there's barriers like transportation or working around a work schedule, all of those life things that happen, those are things that we, especially, um, for us as even an insurance provider, try to figure out, like, why aren't people getting these tests done? Why aren't they getting their medicine? How can we make that better? How can we reduce those barriers? But for me, the thing I recommend always as a physician is you got to be your own self advocate, and you've got to sort of
Absolutely.
sometimes demand, right? Do your research, ask the right questions, or if you don't know the right questions, ask questions, right? And look for supports out there.
Absolutely. And speaking of that, does Aetna and CVS Health offer resources or support for individuals with sickle cell disease?
Yeah, we do. We have our CVS, we have our minute clinics that are out there. We support populations through care management in many of our states where we support people that have Medicaid as their insurance type. We have dedicated efforts to look for who's not receiving sort of what we would call evidence based treatment, and why it isn't an access barrier. So those resources are there. We also link people with community resources. Many states have chapters of the Sickle Cell Disease of America, right? And so while we're insurance and providers are providers, from my perspective, the best resource out there sometimes is community. And that's why activating the community and increasing awareness is so critical for something like sickle cell that is very rare.
Indeed. Well, thank you all over at Aetna and CVS Health for all that you do. I truly believe that these Black Health 365 extended conversations are really helping our community more and to just be more cognizant of what their body is doing and saying and telling them. And hopefully that these conversations will help ease their apprehension to go get checked out when something is wrong. So thank you, Dr. Michelle Bucknor, for sharing your scholarship with us today.
Yeah, thank you for the opportunity to increase the awareness.
Indeed. And so you all can log on to cbshealth.com to learn more about sickle cell disease and do something good for the month of September as it is Sickle Cell Disease Awareness Month. So once again, thank you, Dr. Buckner, and thank you to everyone who is listening and watching. This has been Black Health 365 Extended Conversations powered by Aetna. And I'm KG Smooth, and we will see you on the radio.